The University of Miami-Jackson really prepares you well for the future, and that was one of the main reasons why I chose this program. You will get a lot of help, but you'll also learn to be very independent along the way.
We're primary on our patients, so we're taking care of them from start to finish. And so I think that's great for residency, but we also have help when we feel like we need it from the specialists or consultants. The biggest thing for me was when I'm attending, how comfortable will I be when I finish residency, because that learning curve can be steep just as it is from med school to residency. And so when I was interviewing, I was looking at well-rounded programs. We get exposure to every subspecialty of PM&R, which I feel like is very important.
A big bonus of the program is having the acute rehab hospital and having dedicated services for multiple subspecialties like traumatic brain injury, spinal cord injury, cancer rehab, complex medical care, which is our comprehensive service rehab. We see a lot of transplant patients, which I think is pretty unique.
Something else that's very unique about our program is we have a dedicated research block. And so although research can be intimidating at times or overwhelming, the fact that we have a whole block just to work on our research, I've already submitted 8 or 9 abstracts to conferences.
Jackson is so big. University of Miami is also so big. We really get a wide variety. When you're training, you want to be exposed to as much as possible. And because we have so many different cultures here, there's a lot of diversity with pathology and with the kinds of patients that we can take care of.
We're seeing people from all over the nation and all over the globe. So we get patients from South America, the islands. We're learning not only their languages, but also for discharge, what are the things they need to be able to do from a cultural standpoint as well, and integrate that into the plan of care. Physical medicine and rehab, it's a very team-based specialty, and so we're always working with therapists. We're always working with nurses, the charge nurses, our attendings, even medical students.
Everyone goes the extra mile, regardless whether it's ancillary staff, the physicians, even medical students who are coming to visit. Everybody has this great sense of camaraderie and responsibility that, we're taking care of patients.
We have a lot of nice patients. My co-residents, we spend a lot of time together. We hang out outside of work. We eat lunch together.
I love the people that I work with. I love my patients. This building is amazing. It's brand new.
The building is beautiful. I felt like I would be able to grow and learn and enjoy myself and be in an environment that made it easier to work every day.
Living in South Florida is pretty fantastic. You have great foods and great fun things to do. There's always some kind of event that's going on.
The beach is 5 minutes away, and so from a wellness perspective, that's really nice to have.
We're also in a field in itself where people are very into work-life balance, but being in Miami specifically, I think, makes it a little bit more emphasis on the balance.
Everybody's really putting their best foot forward to try to make sure that everyone's having a great experience and kind to one another. And I don't think that's something you would pick up necessarily on a video or in a pamphlet. It's just a general feeling that you have coming here. That's how you know that you made the right choice, that work doesn't always feel like work.